Hello, everybody. Thank you for watching. My name is Crystal Olivaria, and I'm a scholarship coach. And today we're here to discuss how is your child different from other applicants? How to help your child differentiate him or herself. In the application selection process, the student with the most points doesn't always win. The application process is about finding a good fit. It is entirely possible for the applicant with the lower credentials, the underdog, to beat the applicant with the higher credentials, the defending champion. How can this be? How can your child beat the applicant that may have more credentials than him or her? How can you help your child differentiate him or herself from other applicants? The easiest way for your child to differentiate him or herself is to tell a story. Stories provide a rich response because they generally answer the questions of who, what, when, where, and why. Stories provide more insight into a situation than a standard reply. Consider the following responses of stories versus traditional responses in an interview setting. For demonstration purposes, these examples are going to reflect high school students' interest in working in the medical field and discussing areas of academics, volunteering, his or her why reason, and career goals during an interview for job shadowing opportunities at a hospital. Academics. Story. Out of all my classes, biology is my favorite. I enjoy using the lab equipment. I am amazed at the capability of microscopes and their ability to allow us to see and study cells. In general, cells excite me. While cells are very small, they play a very large role in a person's health. If a person is not feeling well, a sample can be taken and studied under a microscope. Microscopes and lab tests play a huge role in helping doctors discover what is going on inside their patients' bodies. I find this fascinating. I want to learn more about medical tests and how I can help in the process of diagnosis. I want to help people receive proper medical care. Standard response. I excelled in my biology class and earned an A. I find biology interesting and I can see myself working in a lab. Volunteering. The story. I volunteer regularly at the local children's hospital. At first I felt sorry for children who were ill. As a kid, I did not like being confined to a bed when I was sick. I cannot imagine what it is like to be sick and confined to a bed for more than a few days. Therefore, my volunteer activities consist mostly of playing with kids who are confined to bed. I try to make staying in bed as enjoyable as possible. Sometimes we play bingo or card games, other times we color in coloring books, or I read them a story. I enjoy watching people recover and feel better. I want to work in the medical industry and be part of more people's lives during the recovery process. Standard response. I volunteer every weekend at the local children's hospital. Many of the kids are bedridden and therefore miss out on a normal childhood. My responsibilities include playing with the children to help them develop social skills and help them prevent them from falling into a deep depression of having no one to play with. My why reason. Story. When I was in high school, I was taken to a local children's hospital because I was not able to breathe. I was painful to take shallow breaths. After some breathing therapy, an x-ray, and a few conversations with different doctors, I discovered I had a hole in my lung. Prior to this pain, I had been at a friend's house before getting together with a group of friends to watch a school play. I remember my friend's mother being stressed out and smoking 2 cigarettes at a time. The doctor said the secondhand smoke had weakened my lungs. When I hung out with my friends and laughed, the laughter created pressure on my lungs and I had popped one or more holes. The doctor held up an x-ray and I saw different sized air bubbles floating around my lungs. The doctor said I could not take deep breaths because the air bubbles would not allow my lungs to fully inflate. The doctor said I needed to rest as much as possible and within the next few days. I followed the doctor's orders and my body recovered and my lungs healed themselves. This experience made me very grateful for medical professionals. I have tremendous respect for their ability to diagnose problems. Standard response. In high school, I was taken to the local children's hospital because I was having difficulty breathing. I'm very thankful the doctors were able to diagnose the problem. I followed the doctor's orders and I quickly recovered. The experience has led to a deep respect for medical professionals. That's why I want to work in the medical field. My career goals. Story. I'm attracted to the medical field because I want to help people and make a lot of money. I've looked into other career options, but they don't seem to be a good fit for me. I know it's taboo to talk about wanting money during an interview. However, if I'm going to spend 6+ years in a secondary education, then I want to be sure I'm picking a career I will be dedicated to for the rest of my working life. I came to this interview to find out if this would be a good fit. How does your organization help people and support them in their journey of career development? Standard answer. My goal is to attend a prestigious college and get into medical school, participate in internships, and get a job at a well-respected organization. I will work hard, pass my exams with high marks, and be the best student I can be. I know hard work is the key to success, and I am willing to work hard. From these examples, you can clearly tell that there's a difference in the tone of stories versus standard answers. Stories provide insight into your child's personality of how he or she thinks and what motivates him or her, whereas typical standard answers focus on facts and do not help the interviewer get to know your child. When your child shares short stories, it helps the interviewer better understand your child and feel more confident about selecting your child over other candidates. So go to talk to your child and ask lots of follow-up questions. This will help your child feel comfortable talking about him or herself. And as a bonus, I want to let you know that there may be more opportunities for your child to volunteer, intern, or job shadow locally than you realize. I hope that exposing opportunities will inspire you to encourage your child to consider these possibilities. Now I'm going to discuss a little bit about some opportunities at Valley Children's Hospital in Madera, California. I'm very thankful to the medical staff, as the story about the pop lungs is true. Volunteer groups and organizations. People look to the many special events organized from volunteers from high schools, churches, retirements, nursing homes, and scouting troops, corporation and professional groups, and societies. Some volunteers serve weekly, while others select to visit Children's Valley Hospital once or twice a year. The Childlike Big Heart Little Hands program is designed for infrequent volunteer visitors. Also, the volunteer requirements is generally 4 of them. 1. Must have completed the 8th grade. Students 17 years old and under will need to provide a copy of the transcript and a document of their cumulative GPA greater than or equal to a 3.0. 2. In good physical and mental health. 3. Able to communicate well in English. Second language skills are highly desirable. 4. Required to have natural nails if assigned to a patient care area. Also, they have the Canine Volunteer Program, special pets offering tender love and care. The Spot Pet program at Valley Children's Hospital is a unique and specialized program that offers our patients with an extra dimension in the healing process. Canines and their owners visit patients and provide pet-assisted activities, known to contribute to the healing of sick and injured children. Spot teams also visit the staff to provide a fun change of pace in the hospital routine. They also offer the Career Planner on their website. Valley Children's is committed to your professional development, from tuition reimbursement to scholarships and preceptors and clinical education. We encourage our employees to seek out opportunities for growth. My personal top 7 favorite out of 16 resources are: 1. Job Shadowing Program. The Job Shadow Program provides individuals the opportunity to learn about a job by walking through the workday as a shadow to a competent worker. The job shadowing experience is a temporary, unpaid exposure to the workplace in an occupational area of interest to the individual. Participant witnesses firsthand the work environment, employability and occupational skills in practice, the value of professional training, and potential career options. 2. Tuition reimbursement. General program. If you have been a full-time employee or part-time at Valley Children's Hospital for 6 consecutive months, you may apply to receive reimbursement for approved educational classes and programs. Classes and programs will be reimbursed if the class meets the criteria established by the program and is allowable by law. The class must also have a benefit to Valley Children's Hospital. 3. Nursing scholarships. The Nursing Professional Development Fund helps nurses on the journey to nursing excellence. The Nursing Education Scholarship Award is available to assist in academic preparation of undergraduate and graduate nursing students who are employees of the Children's Hospital. 4. Internships. Internships for students have a specific field of interest and have a required number of hours to fill to enter a program, such as a physical therapy program. Students will gain basic hands-on experience under direct supervision at all times. 5. Preceptors. Our new graduate registered nurses are partnered with a designated preceptor to provide a one-on-one clinical and technical training. Staff members develop newly hired peers into competent employees. 6. Career fair. Valley Children's hosts career fair to encourage career development amongst employees to provide educational resources from local higher educational institutions. Numerous internal departments showcase opportunities for the growth within the hospital. 7. Lunch and Learn program. This program is designed to offer short educational sessions during the lunch hour on a variety of educational topics. Some topics offered are conflict resolution in the workplace and relaxation techniques for wellness and stress. Thank you for watching today's Hangout. I hope you found it helpful and inspiring. I look forward to seeing you soon.